about why, what is the significance of this healthcare sector, especially from the Indian context, and then why healthcare supply chain is, what is the significance of healthcare supply chain, and what are the general research issues, modeling issues associated with healthcare supply chain, and what are the major challenges. And then I have given a framework for categorizing the models for decision-making models for healthcare supply chain, and where simulation plays a major role, and how data analytics can enhance the outcome obtained by simulation. So that we are going to discuss. And one of my research scholar and PG student, a team of students have developed a simulation model for a multi-specialty ophthalmic hospital in Tiruchirappalli. So I'm going to share that model with you, the research insights with you. And then I will present some other concepts relevant to healthcare supply chain, and I will conclude my talk. The question comes, why this healthcare is identified as a thrust area under this Gati Shakti, PM Gati Shakti or ATAL codes. You can refer the source what I have cited here, which is based on NIT Aayog, published last year before last year. It says that healthcare is one of the largest sector in India for employment as well as for generating revenue. And according to this NIT Aayog projection, from between 2017 to 2022, by this time, we should have, this sector should have generated 5 lakh jobs, 5 lakh new jobs in addition to the already existing 4 million jobs. Probably if you go to the IIT Research Park website, you could find a lot of startups on medical, especially this healthcare and medical domain. So if you consider this healthcare sector, who are the major stakeholders of the healthcare sector? Of course, hospitals. Hospitals, again, you have government and private, and then pharmaceutical. The pharmaceutical alone, that includes, you have manufacturers, the chemical supplier, packaging material supplier. This alone can be dealt separately. And then you have diagnostics labs, where diagnostic services that includes getting a sample, blood test, sugar test, all these are happening with diagnostics. And then you have medical equipment supplies. Medical equipment supplies includes surgical, dental, ophthalmology equipments, right? Everything. And then the payer means insurance. So who, you know that health insurance and reimbursement options. So what is existing? And then telemedicine. Telemedicine is also, I think yesterday, Professor Gunjan has said a few slides on telemedicine. Telemedicine is, of course, is growing, and it's connected with especially where access to healthcare is very limited, rural and remote areas. This is also growing. I believe a few of the participants may be working on any of this area, especially the telemedicine or some other relevant area. And this data shows what is the projection of growth of healthcare sector in terms of US dollar. You see, especially in the last 4 years, from 2016 to 2022, you could see from 160 billion US dollar to 372. You can see almost the growth is doubled, and they say from 2008 to 2022 to 16.2%. So that's the reason why they identified this as a thrust area, and people should focus their research attention to this area to create more employment and to learn what are the opportunities available in this domain. And this slide shares what is the job opportunities in this domain. And you can find here 2022 estimate for nurses may be high, given the limited capacity. We have limited capacity to train. So there is a requirement of 1.9 million nurses. I think in the recent budget also they submitted a proposal. I think Government of India given a proposal for adding more nursing colleges. So that shows what is the significance of this domain. So you can find a lot of opportunities in this domain, maybe in the form of startup or in the form of some other direct employment. And now comes to healthcare supply chain. So far we had maybe 2.5 sessions. Madam presented about appointment scheduling, and Professor Gunjan shared what about Industry 4.0 and how it is relevant for healthcare. And if you see, healthcare, of course, includes some people they say this is an upstream and this is a downstream. So if you see, of course, supplier is missing here. You have a supplier, manufacturer, distributor, and then healthcare providers. Healthcare providers are nothing but the hospitals and clinics. Payers are your insurance, and then you have patients. So this is one way to show what is a healthcare supply chain, right? And if you see the first session, madam focused on this particular part, how to do patient scheduling with Markov and decision process, where the emphasis was given only to this part. And this is a typical illustration of a healthcare supply chain, as I pointed out. So you have suppliers for all items, medical equipment, chemicals, drugs, everything. And then you have a distributor, wholesaler. These are actually key stakeholders of healthcare supply chain. You have a set of supplier, and these are the service providers. So service providers that includes hospitals, long-term care, in the sense it can, again, hospital, you have emergency department, outpatient, inpatient. This long-term care is connected with inpatients, and then the insurers, and then finally the patients. So these are the stakeholders of Some different researchers use different conventions. Some people they call supplier, and then now here in this figure it is given that all manufacturer, distributors, they treated as supplier, but different authors quote it in a different way. And now what healthcare supply chain is all about. So if you see the traditional manufacturing supply chain, it is mainly about flow of products and information, flow of materials, products and information. So what is the difference between manufacturing supply chain and a healthcare supply chain? In healthcare supply chain, not only the flow of products and materials, but you have flow of patients also. But this flow of patients, sometimes it is limited only to the hospitals. And if you see, healthcare supply chain involves flow of different types of whatever we have discussed, medical equipment, drugs, everything, right? And what are the various stakeholders I have listed? What is the goal? To deliver the product at the right quantity and right quality. And someone pointed out in the previous section, not only waiting time, it is about service quality, throughput, capacity utilization. So many measures are there within healthcare. The quality of healthcare delivery dependent on the availability of the medical supplies, and the availability of resources at the right time in right quantity to the patient, right? And there are different authors reported a different way of defining a healthcare supply chain. So this particular author pointed out the source I have mentioned at the bottom of my slide. This particular author pointed out it is a cost-effective, reliable, and socially responsible delivery of products and services that impact patient, right? So you can just note down these three measures: cost-effective, reliability, because now we had an impact of COVID. We faced a lot of disturbance. That shows how reliable the hospitals are. How responsive they are, how they managed all these disturbance and get back. So, and socially responsible. So these things are connected with your performance. And here I have, this is another way, some researcher pointed out this as a healthcare supply chain. So supplier, primary manufacturer, secondary distributor, hospital, and pharmacy, everything. And according to this source, the measuring the logistic performance of the internal supply chain. In this paper, they divide this supply chain into two parts, and many of other literature also citing this way of categorizing the healthcare supply chain. They divide this healthcare supply chain into two parts. One is the external supply chain, and another one is the internal supply chain. What is external supply chain? External supply chain includes, here you see supplier, manufacturers, and distributors, who typically supplies the material that is required for your supply chain. The material includes everything: medical supplies, drugs, everything, medical equipment, pharmaceutical, everything. Here, this external is more on material centric. Now comes to the hospital. We call this hospital as service provider. In hospital, this supply chain is typically called as internal supply chain, where the aim is, where it is mainly focused on patient centric, and this part is focused on material centric, whereas internal supply chain is patient centric. Here we have flow of materials and information. Here we have flow of materials, information, as well as patients. But predominantly the patient flow plays a major role here, right? Now, This is again the categorization, the internal supply chain, external supply chain, patient-centric or material. If you see in material-centric supply chain, the major issues are, there are three major issues. One, how we are going to maintain your suppliers, sourcing. So in typical supply chain, you have sourcing, inventory, distribution, and scheduling. Vehicle route, scheduling comes under vehicle routing, right? So these are the major issues in a typical supply chain. So in a material-centric supply chain, you can see here, this is connected with positioning and storage and distribution of goods and materials. As pointed out, medical equipment, pharmaceutical, vaccines, everything within the healthcare. And when it comes to the internal supply chain, which is patient-centric, you have predominantly patient flow. How we are going to model the patient flow in a hospital. And what are the here cost reduction is the main criteria here, main performance measure predominantly reported in many literature is cost reduction. If you see patient centric, you have quality, safety, service quality. Again, service quality, you can do it by different way, waiting time, cycle time reduction this way, and then efficiency of service. Here, patient centric because you have to respond in a very short lead time and you have to maintain 100% service level, right? And this is another categorization of patient-centric logistics alone. So within a hospital, we cannot say that there is no material flow. Material flow is there, but patient flow predominantly plays a role. If you see here, the patient flow is again categorized into three. Patient, of course, there's some authors call it as logistics, some call it as patient flow, some internal supply chain, whatever, right? So you have patient logistics, employee and visitors. Within patient, you have emergency department, outpatient. Outpatient nowadays we have general OPD and specialist OPD. You have ophthalmology, gynecology, you have pediatrics. So many OPDs are there, right? And then you have inpatients. And when it comes to goods, I mean material, you have medical as well as non-medical. Non-medical connected with the catering, the foods, cloths and laundry, bed logistics. And when it comes to medical goods, again, you have all the pharmaceutical, sterile goods, blood, everything. Okay. Now, so I hope now you are clear what is the major outcome of this course, what you can expect from this course. So we have healthcare supply chain, which is of two parts. One is external, which is happening predominantly outside the hospital, and another one is internal, which is very well connected with patient flow. And in the external supply chain, major issue is cost reduction with reference to material, and internal supply chain is connected with improving the service level. Now the question comes, what are the challenges in a supply chain? The healthcare supply chain is really very complex. You know, you have a lot of items. You take medicals, essential item, critical item, non-critical item. So, and this is again connected with human lives. So they are very critical. And the requirements of patients also keep on changing nowadays, right? Their expectations are changing. And now you have a lot of competitors in the market, even in the healthcare. Because of competition, they tend to reduce the cost, especially cost reduction in the material logistics side. And in the internal logistics, internal supply chain side, healthcare needs to maintain a high service level. And of course, these two are conflicting. If you want to keep high service level, again, this may increase the cost. So these are some of the challenges. And healthcare system have to reduce the cost without affecting the quality provided to the patients. Not only that, healthcare, you know, it generates a lot of biomedical waste, right? So harmful waste is associated with healthcare, and you need to, considering the environmental concern, we need to eliminate, the hospitals or the providers need to eliminate the waste material. And you need, of course, you would have read some news where some medical waste is being dumped on roadside somewhere and all. So this is also a niche area, right? During the, of course, you know that COVID, again, what happened there, all of a sudden paracetamol, even hand sanitizer become a very high demand item, right? At a time it was a very cheap and we had a demand for that. So the demand for drugs also, paracetamol tablet, right? The demand for drugs become highly unpredictable. And this again results in overstocking and understocking, which affects the cost. And COVID-19, of course, why supply chain is important. If you see, I'm just giving you one or two examples. COVID-19, this pandemic enabled to witness how to exploit a local supply chain, right? For time sensitive and demand critical products. This is just an introduction for you, that's all. And you all know that when the first wave of COVID attacked, by March 2020. At the time, February or March, PPE, I do not know how many of us know about PPE. PPE was not common at that time, right? Even I was unaware of what is a PPE, right? Now, India was a PPE importer in February 2020, and we have no local manufacturing capability at all, right? In India, we have no capability. It is relatively cheap, but when COVID struck, it becomes a very critical item, right? You can think about those period, right? And we try to get this PPE. India tried to source this PPE globally from global markets, but very few countries were there in producing high quality PPE. And somehow at the time of crisis, uh, in India imported around 52,000 kits of PPE, medical kits, which were fit for medical use. But what happened immediately after that, you see, by the joint efforts by various ministries like Ministry of Textile, Healthcare, Defense. So they had a collaboration, and with that collaboration, India became the world's second largest PPE kit producer in just 2 months, and we developed the first reusable PPE kit. You see, this says that in 60 days, 56 times growth, right? This is for PPE, and you see what is the supply chain idea behind this. So we definitely this can be a material part of supply chain, right? Material centric supply chain, right? You should know how this. You can refer. I have given the link for this. Plenty of content are there. You can just read how a material centric supply chain enables to achieve this goal in a very short span. And similarly, second wave, we had a oxygen, shortage of oxygen cylinder, ventilator. You all remember that, right? Similarly, there was a demand for hand sanitizer. You see how a redundancy or cross fertilization of technology can be exploited. So what happened? Ventilators, of course, no hospitals used to keep ventilators. You know, it's expensive and only it may not be needed. Only in ICU, few units may be needed. But what happened? When there was a demand, the automobile manufacturers like Mahindra, Ford, Maruti, they were able to produce a low-cost ventilator in 18 days. So this is again material supply chain, material-centric supply chain. Outcome of material-centric supply chain. I told you they should be resilient enough. This is the outcome of that. So within very short time notice, they would have come back because they have some technology related with the compressor and all in car. So similar with the cross fertilization of technology, they would be able to achieve this. You can find a lot of papers on each of this topic, right? And hand sanitizer, how hand sanitizer fulfilled. So brewers and distillers. So because it's a product, right? Liquor, who produce liquor, they diverted this to producing hand sanitizers. So this is what we call it as a supply chain, material centric supply chain. Shifts have occurred in short time frame, normally few days, few weeks, for what normally takes months to achieve this goals, right? So now this highlights, without supply chain practices, do you think that these are possible? Definitely not. So supply chain practices in healthcare enables the healthcare to achieve efficiency in a timely manner, right? So with this introduction, I am going to highlight what are the issues that are available in healthcare supply chain. So you please try to understand healthcare supply chain. It has got two parts: the external material centric supply chain, internal patient centric supply chain. The material centric supply chain consists of three major parts. This is again sourced from this paper, Volland et al., published in, I think, EJOR in the year 2017. They have categorized this external issue into supply and procurement related, inventory related, distribution and scheduling related. Vaccine distribution can be a simple example for this, right? Now we will go to each of this topic. I'll just rush up, right? Within procurement, supply and procurement, that's called purchasing. Within that purchasing, what happened? Hospitals, don't think that each hospital will go to a supplier and procure. They have a separate group purchasing organization. What is this group purchasing organization? You know, it is like a consortium where multiple hospitals can be a member of this GPO, and this GPO will have tie-up with suppliers. What is the advantage? Instead of each hospital buying, say, 100 units of medical equipment, they will consolidate this and put a single order. What is the advantage? You will get price discount, price economies of scale you can achieve, and then price transparency, price assurance, right? So this itself is an research issue. Those who work on supply chain, they can focus only this purchasing and GPU. So how to, especially this will help the purchase manager to identify and what are the different alternatives. You see in a hospital, how many items will be there, critical, non-critical, how many items will be there. So if you just work on sourcing policy, how much to order, which supplier to order, when to order, this itself can be a great problem to solve. And second category, apart from purchase quantity, we have supplier collaboration and supplier integration. All the examples what I cited earlier, they are explaining how to exploit they are a great illustration for how to go with supplier collaboration. So this collaboration includes VMI, vendor managed inventory. So once you have a great tie-up with the suppliers, maybe you can ask the suppliers to keep inventory on behalf of you. So that's also possible. You can have long-term contract. You can share the information. For that, you need to share your patient information. Sharing patient information is easy nowadays because all the hospitals, they have electronic health records. The patient's data is available. So with each day's data, they can easily track what disease they are and what is the movement of different drugs and all. They can easily track this data and share this data to the supplier. So this way, it can enhance the supplier collaboration. But the issue is how to increase the data transparency subjected to some constraints, legal and IBR constraints. So this can be treated as a modeling issue. And those who want to work on supplier collaboration, they can take this as a research area. And another important data analytics, computer science people, they can work on demand forecasting. You see, it is very difficult because especially in a hospital, what disease, patient with what disease will come, how many numbers will come, what will be the drug requirement. Earlier, it was very difficult to forecast, but with availability of data, definitely you can go with machine learning models. On a Monday, what would be the, because we have done this. When I'm going to present my case example, I'm going to share it. We have electronic health record available with us. So with that, we were able to model it. So what could be the number of patients that can come on a weekday, on weekend, and which time, say morning, peak hour, how many people can come, and what age group they can come. All this with the availability of EHR you can do, and the machine learning models, application of machine learning models for forecasting is very important. And what is the effect? If you have forecasting, it's good. If your forecasting is not there, then this may result in overstocking, understocking. And again, drugs may, because of the end of life of drugs, say shelf life, you have to results in losses of drugs. Again, it adds cost to the hospital. So this is about supply and purchase side, right? Purchasing side. Now you are making a purchase. So what happens? Product material will flow. Then comes the inventory. So inventory, what are the major issues? This is mainly connected with, again, you need to categorize your item. That's a major thing in inventory alone can be considered as a separate area in material-centric supply chain. So you need to work out what is the inventory, best inventory policy for your product. So you have critical, non-critical, fast-moving, slow-moving, so many items will be there, right? So for that, you need to come up with the inventory policy. And then there comes the inventory location. So if you see typically, the external suppliers will send the items. So what happened? This is actually the point of consumption or care unit. From here, you may either place the order to a central stock. Every hospital, they have their own inventory, and apart from that, you have a central stocking. So central stock unit. They need a question which product and how much to stock, because all are medical and they have a shelf life, specific shelf life, right? You need to minimize the cost associated with this inventory as much as possible. You need to minimize your wastages also. So here either you can do this way or you can place the replenishment order. So every hospital will have a purchase manager or a project coordinator, project manager. So they will do all this activity. Of course, tomorrow we have a session from a doctor from AIMS. You can we may ask him to elaborate how they are doing all this, right? So here this will go from the purchase department either directly to the central stock, or you can go to the direct external supplier. The supplier may deliver the item either through central stock or directly to the control unit. So the shortages, again, of course, the inventory visibility is a great area to work with. And you have to share the real-time demand data through IoT or of RFID. So this will helps in reducing the cost associated with inventory. So this inventory is the second issue. And third issue, as I pointed out, we have a distribution channel and then vehicle routing and scheduling. So this is connected with material centering. What is the distribution channel and scheduling? You need to develop distribution strategies to deal with the movement of goods, right? What are the idea here? You need to minimize the storage cost. You can go for when direct shipment is better, when cross docking is better. So this kind of analysis we can do. You can build a lot of optimization model here. And distribution between suppliers and hospital. Also the distribution, they can take the issues connected with waste management, how to use a reverse logistics for managing the hospital waste. So this is a great issue with regards to the distribution. And please note down there is a open source software available named HERMS, right, which is exclusively for designing the vaccine supply chain, distribution supply chain. So this is again connected with vehicle routing and scheduling and waste management. Waste may be due to patient treatment. Okay, you have blood samples collecting, diagnosis. So all these waste, how we are going to deal this biomedical waste, right? So this can also be an issue connected with distribution and scheduling. So this with this software, this HERMS full form is highly extensible resource for modeling supply chain. So this is open source software. Those who want to work on vaccine distribution supply chain, you can just download this model and make an attempt. And this is how a typical supply chain is. Even COVID-19, the vaccines, how they got distributed. You have a manufacturer, and then this comes to a government medical stores depot. And from government medical depot, maybe a centralized depot, from where it goes to regional, or sometimes from here it may go to a state, or directly from the manufacturer it will go to state. And then you have divisional vaccine store, and then district vaccine store, primary health clinic, and then these facilities and all, right? Community health center. So it will go like this: primary health center, community health center. So this way you are going. Now, what is the idea here? How we are going to reduce the cost? How we are going to reduce the wastage, right? So these are the issues that you can focus on when you work on material centric supply chain. Now the second part within the hospital, it is patient centric, and there are three main issues connected with the patient centric. One is the appointment system, right? And second one is the patient flow, and third one is the resource management. In appointment system, of course, madam, in the first day's Monday session, madam talked about appointment system. And appointment system will have three types. What is the appointment rule that we are going to follow? So there are a lot of rules available for deciding the appointment for the patient. So you have how to fix the block size, right? And how to fix the appointment interval length. There are research issues on this. And then patient type. Always in a hospital, if you see, they will divide the patient. Suppose if you go to a hospital, ophthalmology hospital, they will divide you whether you are a new patient or follow patient, right? Whether you are coming for, madam presentation pointed out that they have outpatient, healthcare diagnostics, and emergency patients. So you have to have a category of the patients, patient type. With that, you can allow sequencing of patients. So what type of patient, and then what type of appointment, what type of sequencing. And then adjustment policy is also connected with especially to address the uncertainty. Suppose when you have an appointment system and all of a sudden patient unpunctuality or patient no-shows will be there. And sometimes emergency patient may come and walk-in patients may also come. So how we are going to address these uncertainties into account is a great research issue when you focus on internal or patient-centric supply chain. Especially real-time scheduling is gaining importance. So you are going to get the patient's data through RFID or something. And then based on the type of patient, you are going to fix a schedule for him, right? And second thing within the patient-centric logistic or patient-centric supply chain is patient flow. Typically, you see when you go into a hospital, we need to visit so many, desks. So it maybe it can be a registration, and you may have a pre-consultation, consultation, post-consultation, and all. Diagnosis. Pre-consultation may be a diagnostics, right? So. And you should have a optimum balance between patient flow, resource availability, everything. Otherwise, what will happen? It will result in waiting. Of course, why it causes waiting? Variability. The variability is associated with patient arrival, variability associated with the service time for each patient. and resources. So when you have limited resources, then this will create a bottleneck, right? Create queues, delays, and it will add additional stress to the hospital resources, staffs, and doctors. And patient flow and information flow are related throughout the patient pathways, right? And actually, patient pathway, there is a, research available on how to design the patient pathway, right? Upon the arrival of patient to a hospital, you have to design, you have to the algorithm or whatever should report what is the optimal path for him, right? Depending on his history, right? So directing the patients on their arrival to optimal path using a real-time information through RFID or electronic health record is an important research issue. So apart from patient flow, the third issue connected with patient supply chain or patient logistics or patient-centric issues are resource allocation. So, um, resources here, it includes both staffs as well as equipments. Staffs include nurse and doctors, and equipments can be anything. It can be MRI, it can be ultrasound scanning or CT scanning, whatever. So, the purchase and maintenance cost of the medical equipments are high. So they cannot keep these resources ideal, right? And they have to see how to utilize these resources effectively. So this resource allocation includes proper planning and allocation of resources. So that resources include medical equipments, beds, doctors, rooms, even operating rooms. So there are algorithms focusing on scheduling of operating rooms, allocation of beds and other resources. And equipment allocation decisions, like especially the highly expensive equipments associated with radiology, oncology, surgery. So these resources, you can do a lot of research on this. Because hospitals are available a lot. Once we need to approach them, and once we get some input, definitely we can do a great research on this area. So maximizing the equipment utilization while minimizing the patient waiting time or improving the patient service level. So this is a great area. So you can work on a multi-objective model here, right? So these are the issues. So I highlighted mainly three major issues connected with material-centric supply chain, like purchasing, inventory, and distribution. And connected with patient-centric supply chain, I reported the three issues that is connected with appointment scheduling, patient flow, and resource allocation. So these are the issues associated with predominant issues associated with the supply chain. Now comes the modeling aspect. How can I model these issues? If you see mathematical models, especially optimization based models, are predominantly used for material centric external supply chain because the variabilities are variability and complexity are quite less compared to patient centric internal supply chain. So what are the models? I can go for linear programming, integer programming, nonlinear, single objective, multi-objective. I can go for queuing, stochastic, dynamic programming. What are the approaches? These are the mathematical modeling and these are the approaches. I can go for exact approaches or I can go for non-exact approaches. So the non-exact approaches include heuristics or meta-heuristics like GA and PSU. So I shared one of the paper based on cuckoo search optimization for pharmaceutical supply chain. So if you see the four paper that I shared with you, two of them are connected with material logistics and two of them are connected with patient logistics. Okay, so I try to cover both. And second part of the modeling is simulation model. Especially simulation model is very common with the patient-centric supply chain. Among this simulation, you have four approaches which are common. One is Monte Carlo simulation, system dynamics, discrete event simulation, and then agent-based simulation. I'm sorry, in case if you have any question, you may interrupt me and raise your question because I could see only my screen. So please feel free to interact with me. In case if you have a question, I could not see the chat box, so you may unmute and talk to me if you have any question, right? And hybrid model. In this here, I'm referring hybrid model as a model that may be using either two or more of these simulation approaches or a simulation combined with optimization. And what is Monte Carlo simulation? It's a static as well as stochastic model. So predominantly Monte Carlo simulation is used for economic analysis in healthcare, and system dynamics are used. System dynamics are mainly for evaluating the healthcare policy. Suppose I want to model how a COVID-19 will spread. So you know that there are models available for this. SIR, we call it as SIR, susceptible infection and recovery. And one more model is the SIER. susceptible, exposed, infection, and recovery. So where you are going to design the entire system as a stocks and flows. So by using certain ratios, you are going to manipulate it. At the end of this lecture session, I have some simulation models which I will share with you on all this agent-based DES and SD. And then discrete event simulation model. Discrete event simulation model is the most commonly used for patient-centric, where we are going to model the individual units. It may be an emergency department or outpatient department or operating room, whatever, right? Where you are going to model the behavior of this, including patient, everything, how it evolves over time. And agent-based simulation is a recent thing, maybe last 5 to 10 years. Here it is possible to model the behavior of patient, right? It is possible to model the behavior of patient, where each patient can be treated as an agent, right? And we need to define certain rules, and that rule will tell them what is the input and how they should respond to that input, right? So this is about category of simulation. And within that simulation, there are 3 categories. I mean, within that simulation, 4 group of simulation, we have 3 levels. Level 1, where we are going to model the individual patients. But this normally very limited and not much connected with our scope of workshop. So here we are going to model the human body, right? And this simulation is for individual patient. We can build the model, simulation model at the human body level or at a specific organ level. Preferably here, the idea is to study the effects of certain drugs on the particular organ or on a particular part of the body, right? This particular simulation is called as pharmacodynamics, right? And this workshop is not much connected with this area, level 1 of models. And here the purpose is to study the effectiveness of some drugs, what is the effectiveness over a period of time, how the recovery is. So if you want to study that, you can go for this kind of simulation. And this workshop is mainly connected with this level 2 model, where earlier it is patient level modeling, right, or organ level. Here it is healthcare unit level modeling. We are going to build a simulation model of a healthcare unit. It may be a hospital as a unit, or it may be a specific department in a multi-specialty hospital, whatever, right? It may be an operating room, emergency room. And here the idea is we will be focusing on all the 3 or any one of the issue, right? Maybe patient movement, right? Where the bottleneck is created, patient movement we may study, or we may study the resource allocation, or we may study the appointment scheduling and other things. And the last one, which is again the level 3 model, which is a macro kind of a model, right? So here so first one is patient level and then unit level, and this is a system-wide model. So you are going to model the entire system, right? So here we are interested to know, like as I said earlier, how a disease will spread, right? Or how many doctors you may need in 2030. Again, you can see what is the population, what is the morbidity, how morbidity is affected by so many factors, population is affected by what factor, how many patients will come, what will be the mortality. So with reference to this, you will work out how many doctors or a hospital you may need, that you can project, right? This is a kind of a model. So we are not going to give much attention to this model also, although I can share some details about this model. Now, if you see predominantly out of these 4 approaches, discrete event simulation is very common in healthcare, right? And especially for focusing on the healthcare operations, right? So with this introduction, I'm just because I have to finish, right? I'm just focusing on my case example. So now you know what is healthcare supply chain, what are the modeling approaches, what type of simulation modeling approaches, and what is the focus of this FDP, right? Now you know that waiting time in hospital, you know, definitely it's a very important criteria. And even in one of my paper, we identified that waiting time is the most commonly addressed performance metrics in hospital, which affects the patient satisfaction and everything. And in this research, or in this case example, we have taken a ophthalmic clinic located in Trichy. Why ophthalmic clinic? You can see there is a justification for that. The global data showed that there are 36 million blind and 217 million moderate and severe visual impairment. So this was due to aging and other reason people are getting eye infections. So eye kind of a disease. So there is a necessity for a good number of patients will be there, so we can do a good research on this also. So this research is based on a data collected from a multi-specialty eye hospital located in Trichy. And of course, this hospital is a well-established hospital. It existed from 1936. The left-hand side, what I'm showing is the hospital's picture 1936, and right-hand side is what the hospital looking now. And this hospital, they provide a one of the reputed hospital in Trichy. They provide a cost-effective eye care, and they manages 1,50,000 outpatients per year, 20,000 surgeries, and 2,500 laser procedures. And this hospital consists of, typically, if you go to a hospital, you can observe structure. They have a registration counter, they have a consultation, the optometry testing unit, eye checkup. All these are there on the ground floor. And they have a specialist. It's a 3-floor building. You can see that. The ground floor, they do all this. In the first floor, they have a retina and the cornea related diseases will be handled by first floor. And glaucomia, they are doing it in the second floor. And more than half of the arriving patients are treated as outpatient. And I'm just reporting you the problem statement, right? The healthcare providers include general and specialist. So that's what health providers include: ophthalmologists, optometrists, nurses, pharmacists, everything. And the hospital is operational for 6 days, Monday to Saturday, and opens at 8 a.m. But actually the registration, everything counter will start at 8:30 and closes at 5 p.m. And predominantly the patient arrival is happening in the forenoon session, afternoon session very few only. And there will be a lunch interval from 1 to 2:30. Currently, this clinic, they have no appointment system. And the patient arrivals are random. I have electronic health data collected from this hospital, which I will share with you. Similarly, the individual patient's condition, again, the patient arrival is random. And what are the services he requires is also random. Whether he may need a pre-consultation, consultation, everything is random. Unless he come and register, the only after diagnosis will come to know. If he is a follow-up patient, we to some extent they know, right? Again, service time is also, so because of arrival and the complexity with this disease, the patient pathway, what are the path he has to follow? What are the stations he has to visit? That is uncertain. Service time is also uncertain. That's the reason why you have queue here. This is a queue in that hospital in the first floor on a peak day, you see here. The major problem faced by the clinic is the waiting time, high and variable. At present, the waiting time was 40 minutes. Okay. And complexity in the patient flow is there, and long queues are there, especially with common sources, resulting in overcrowding. And the hospital management, they are interested to know the effect of scheduling. They don't have scheduling now. They wanted to visualize what will be the effect of, suppose if we introduce scheduling. Within scheduling, different types of schedulings are there: appointment rule, patient tracking, everything. So if I introduce appointment scheduling, what will be the effect? Will it be okay or not? So they wanted to evaluate this. And so for this requirement, we build a simulation model for this hospital. And we studied the waiting time. We validated our model with the actual system. And then we proposed some scenarios how to reduce the waste. And what I am showing on my right-hand side is a typical patient flow. So this is the first stage when you want to build a simulation model for a hospital patient-centric healthcare. You have to do this. So what is the patient arrival? They do registration. And if it is a new patient, I have given a description. If it is a new patient, they have to give all the details. And then the receptionist will provide a medical record number. And the patients, usually they used to keep the patient's demographic details like age, which place they are coming from, and visit date, everything will be recorded. So here there is a lot of scope for using data analytics here, because we have EHR. And for follow-up patient, just they have to give their MR number. So all the detail will be fetched by the receptionist from the old record. And they have a simple computer eye testing, and then they do optometry. And then they may have consultation. Depending on the disease, they may need either general consultation or for specialist consultation. And then they need post-consultation, whether they need a specs or whether they need any medicines or drops. And then they have to visit a pharmacy, that's all. And for any simulation model, this is the procedure. First, you have to make structural assumption. Structural assumption, how the hospital appears, the same way you have to reproduce. That's called the structural assumption. And data assumption, since you cannot say that the arrival is variable, service is variable. So you need to make some assumption for that. Right here also data analytics plays a major role. So what happened with the available data, it is possible to fit a specific distribution to this arrival data, service data, everything, right? So this is what we did here. And this is the typical data they shared with us. They are categorizing the patient into regular and follow up. You can see here patient name is there, what is the age, and what time he registered, and these are all automatically generated data. So when he is registering and when he is going to optometry, sign in, optometry sign out, only 6 minutes, then consultation sign in and consultation sign out. So there may be, since 1 hour is not possible, maybe since this data is to be cleaned. Actually, the data analytics, collect data and then you need to clean the data. You need to filter out the certain things and then you have to proceed. So this is a typical healthcare data. And then you need to get from this, you need to get a descriptive statistics. On Monday, how many patients are different age group, male, how many female. And then you can see here from this data, especially Thursday, Friday, they have a lowest number of visits. And we have taken only the forenoon session, not the afternoon session. And from the data collected, we need to fit a distribution to this data. On a Monday, when a patient visits optometry, this is the distribution. Tuesday, it's Johnson bounded, and these are the parameters connected with them. And maybe Wednesday it is long because it varies. So with the reference to this data, we are getting patient arrival, service time distribution happening at different, and service time distribution for follow-up patient. So this is for regular patient and this is for a follow-up, first time patient, new patient and follow-up patient. And this is actually the healthcare model developed with a software called Fluxim. And next week, when you come for a training, 2 days, we are going to train you on this. And you will be getting a 6 months license free for this software, right? So this is, you can see here, this is the ground floor, first floor, second floor. This model was built by a PG student along with the research scholar, right? And right side, what it is showing is a patient flow, right? We need to define this. And this is actually an outcome of our findings. So here what you need to do, you need to build a simulation model, feed all the input, run the simulation model, get the output, right? And you need to validate your output. What is the average available with your EHR data, average waiting time with the EHR data, and what is the waiting time provided by the simulation model, you can compare. So this is actually PCI 1 is patient classification index. So this PCI 1 refers to a new patient and 2 refers to a follow-up patient. So what is the waiting time, right? And we proposed some scenarios. So I will just complete in another 5 minutes. We proposed a scenario. One scenario to reduce the waiting time is, so we come to know that our developed model is valid because the model's waiting time matches with the real hospital's waiting time. So we proposed some scenario because there were more waiting in the second floor for a glucomia consultation. So we thought of adding a resource there. And then we proposed an appointment scheduling. What sort of appointment scheduling? We wanted to smoothen the arrival pattern. How to eliminate the variability in arrival? We put an appointment scheduling. So considering the resource availability, we have given an equal number of arrivals per hour. That there is a rule, appointment rule available, fixed number in each block. So that way you can do, and this reduces the waiting time to 16.13 minutes. And when we combine these two, the waiting time is reduced to 12 minutes. You see, this is the use of technology in real time healthcare. So when the waiting time was 40, it is possible to reduce the waiting time to 12.45. So this is only a typical illustration where data analytics can add value to the simulation. So if you see big data analytics, mainly you have process mining, machine learning, and data mining. And in simulation, you can refer this paper. This paper highlights how data analytics can be useful for simulation. And I'm just rushing up my remaining slides. You can see here process mining. I told you that once you want to build a simulation model, the very first stage is to create a process map or a flow chart of the patients. So now you have a software for it. So all you need is to provide the EHR data. With this process mining, you can build this process map. There is an open source software called Disco. So if you have any data, you can just feed it and it will try to create a process map for that. And then we need to fit the distribution to this data. Now we have a module called export feed, which is available in Fluxim. Whatever data you collected, you feed that data to the export feed, it will fit a distribution for you. And then we have machine learning models, which can be useful for inferring the results and building the model, right? And so this is how you can interface data analytics with simulation, right? And this is some of my paper. Whatever I presented so far is based on the outcome of this paper, two paper. One I published with Journal of Operational Research Society. Of course, it took 2 years. You can see October to June 2020. And then another one which I published in a simulation journal, Transaction of Society of Modeling and Simulation, which is focusing on OPD, right? And with this slide, two more slides, I will conclude. And so there is a agency called Gartner. So Gartner is a consulting firm based in US. They do survey, extensive survey, and report who are the top 25 in supply chain. So you can just refer to the survey. They have a separate survey for supply chain, separate survey for healthcare supply chain. I am just projecting only healthcare supply chain here, right? So healthcare supply chain leaders can refer to this research report to build a resilient and socially responsible supply chain. So what this research outcome says with reference to US healthcare, you can see they are considering three aspects: reducing cost, aligning increasing financial pressure, and then sustaining and building risk resilience capability. That's what I was talking to, resilience capability, how we responded to PPE requirement, ventilator requirement, and that. And then ESG, environmental, socially, and governance based. So how the significance given to environmental, social concern, and what is the governance in a hospital. So with reference to that, they have categorized the hospital, and you can refer this report. Whatever I have shown here, you can find this content. And according to their survey, Cleveland Clinic is #1 in supply chain practices. Again, if you refer to what are the supply chain practices they have, they concentrate both material as well as patient centric. What they do with material centric, an analytics platform for monitoring the suppliers, demand planning tool for inventory visibility. I was pointing out inventory visibility with IoT, RFID is an emerging issue. They are implementing it. With this implementation, they become #1 in supply chain, right? Healthcare supply chain. And they are implementing ERP and inventory management system. And then if you see, so of course they focus on all these area, robotic process automation. And these are connected with the inventory supplier and all connected with material centric supply chain. If you see patient centric supply chain, they use artificial intelligence and big data, right? What I have shown in the previous few slides to improve the operating room supply chain efficiency and to reduce the cost of improving service level, right? And these are some of the softwares available, plenty of softwares available. These are commercial software packages. And especially for healthcare, you can see auto mode, expert fit. Apart from that, we can use Fluxing, Witness, AnyLogic. And there are some open source softwares also available. These are the open source. I think some confusion is there, right? Right. These are some open source softwares. And the Salabim is based on Python, and JamSim and CloudSim are based on Java. So these software you can download for open source, free of cost you can use. So with this, I will stop. So you have anything to raise questions? I wanted to share the model also with you. Is my screen visible?
Yes, sir. Yes, sir.
Yes, sir.
Yeah. So this is actually the 3D model of the hospital, what we built in Fluxim Healthcare. And this license will be offered to you for 6 months free of cost. So I'll just run this model. You can see. So first you need to import the hospital's layout: first floor, ground floor, first floor, second floor. I think, is it visible? So I think maybe graphics. Let me zoom it further. You can see here, right? The patients are there. He's arriving. He has to wait. After that, once registration, after 8:30 only registration will open. From here, people will move to registration. And you have a patient track here for regular patient and a follow-up patient. So this you need to define. So you are going to learn all this when you come to campus. Patient track. This is for regular patient. This is for a follow-up patient. Okay. And then you can you have to follow all these procedure, right? You have to these are the model entities. You can drag this entity here. You need to define its attributes. And once you connect it with nodes and networks kind of a thing, it will run. The model will run, right? And okay, let me run this fast. Okay, I think there is a small interruption. The graphic is not supporting, I suppose, right? Maybe in a system it will run. It is taking some time, right? Okay. Anything else? I'll stop now. I have few more content to share anyway. Um, just have a small interaction now. You please tell me, or you have any questions on this? You have any questions? Is it too boring?
Good evening, sir. Not boring, sir.
Oh, thank you, thank you, thank you.
Sir, you are mentioned computer science people working with the ML model with the help of someone case study to work and train the healthcare supply chain based model. What are the features we have to concentrate on this kind of model, sir?
So in the sense you are asking that operational model, what I have said now, is it?
No, sir. What are the inputs we have to feed into the model, sir?
Okay, okay, inputs. Okay. Just a minute. If you have time, I will show the input also to you, right?
Okay,
So
sir.
for inputs, I will tell you inputs you have to feed. Let me stop it here. It is running actually. It will stop it. Input you have to collect. I think I have shared the EHR data, right? This is the EHR data. I hope my screen is visible, right?
Yes, sir.
Suppose
Yes, sir.
you know the registration time. So with the registration time, you can come to know the arrival time, right? Patient's arrival time, inter-arrival time you can take. I'm just showing in the software you have a tool called the export fit. What we need features is we need what are the random parameter associated with your system. You can feed all these randomness to your model, like arrival, service time, the patient. Suppose you do not know. Suppose a first-time patient may come for a retina or cornea or glaucoma. You do not know that. So you have to collect this data from the hospital. This data will tell you out of the arrival. I think we have, you can see we have around the data for around 10,000 patients, I think, close to 10,000.
Okay, sir.
Right. So with this data, it is possible to model which, suppose out of the 10,000, you have say 30% are from general consultation, 10% for glaucoma, 10% for retina, 20% for other. So with this, you can go to this expert field, and this expert fit will fit a distribution for your data. Anyway, you are going to learn it. I'm just maybe let me put this as your ATAL model 1.
Sir, what I'm asking, excuse me, sir.
Yes, please.
Sir, we have to forecast the demand for the, I think, what decision will make from this model, sir. We have to
No, no.
finally, we have to forecast
No,
through
no.
the ML model.
Listen. The purpose of this model is to test the waiting time. We are going to evaluate the waiting time.
Waiting time only, yes, sir.
Yeah, no. You can do anything. You can increase throughput. You can think
Okay,
about resource utilization. How long a doctor is utilized. How long a staff nurse is utilized.
okay, sir.
Everything you can take.
Okay. I
Right.
will
So
use,
because yes, please tell
I
me,
will
sir.
use ML model to forecast the
Definitely.
some decisions, sir.
Yes. You have this data. With this, you can make a forecast.
Yes.
And this forecasted data can be fed as input.
Okay.
You
That's
can
what.
fit distribution also. You see, fit distribution, it will take only 1 minute. Oh, sorry.
But in this tool already developed by someone else, sir, with open source. But
Open, yeah, I shared open source softwares also. The
yes.
problem is you won't get this kind of graphics in open source.
Oh,
See, I have shown a 3D model here.
okay, sir.
This
Yes,
kind
sir.
of thing you will not get. In any logic also you have all the system dynamics, everything is there. That's another software, any logic. So this
Okay.
kind of appeal you may not get. Otherwise, you can use open source also. I told one Python based, another two Java based. You can try that also.
Okay, sir.
So
Thank you, sir.
when you come to campus for a training, I will give you a very simple problem, right? Assume that a
Okay,
patient is coming, he is doing some registration, doing some pre-consultation, and then consultation and leaving. So you can just do some experimentation with this model.
okay, sir. Thank you, sir.
Okay. Thank you. So any other questions?
excuse me, sir.
Yes.
Apart from this statistical option, is there any built-in algorithms, ML algorithms have been developed with this software?
Yes. I'm going to this experimenter. And this experimenter, are you, whether the screen is visible, experimenter screen?
Yes, sir. Yes, sir.
Yeah. So what I do, I will create this as my base model. I can add some scenario. I can do optimization. And if you see optimization, it works based on apt quest. So there is a license. So with this you can do. Yeah, this is also possible.
Okay, sir.
Yeah.
And one more question, that inventory control you are saying, no, sir. So the inventory control comes under this logistics kind of management, right, sir? We can make use of this ML algorithms under this logistic management in terms
Madam,
of
actually,
inventory.
no. Actually, if you want to use ML, you can work on visibility. How can we increase the inventory? Now, see, I'm just giving you an illustration. I have this many 10,000 patients coming on a typical period, right?
Yes, sir.
So
Yes.
you should have access to the disease they have. Corresponding to this disease, what is the medicine they prescribed? That you have. Why don't you create a tool to make this number of material that you used, the drugs you used, to the supplier directly? This information should be available to the supplier, so that he will come to know real time on day one how many units have used, and day two how many units have been consumed. So all is what you need. You have this data. You see how to convert this into an inventory data. They are all connected. You see, you come up with a machine learning model that will help you to identify that will help you to find out what is the inventory, and this should be made available to the supplier who is delivering the drug.
Exactly, sir.
Yeah.
Okay. Thank you, sir.
Okay. Okay. Any other questions? Is it okay, or are you or I bored you for a long time? So anyway, you can learn this. There is a let me just quickly finish this. Read data from file. Okay, I have a data. Let me take this data and just copying this data. Assume that these are the inter-arrival time of patients. Okay, it's enter data. So let me put paste. That's all. So I'm just feeding all the data, arrival data. I've just randomly taken. You can take all 9,555 data entry to this, right? And then you okay. Now I want to fit what is the earlier arrival was random variable. I'm going to fit a distribution for this model. You can see here. Once you give automated fitting, is my screen visible? You have three types of distribution. Seems to be appropriate for the arrival. Variable distribution with the parameter scale and say been alpha beta will be there. Maybe scale parameter, shape parameter. So this is the most appropriate for the arrival. So typically this is done with the goodness of fit test. Either you maybe statistics, those who work on statistics, you know these tests, case test, chi-square test, and Anderson-Darling test. So you can do case test and see what is the whether to reject or not. No, you have to accept. According to this test, the data belongs to variable distribution. So this kind of learning you can will be useful for you once you attend the training session. Okay, I will stop now. Anything else? This is another software called AnyLogic. Maybe we'll discuss this later. If you have any questions, otherwise, shall we stop now?